anxiety is interesting because we kind of lump anxiety in one, but technically up till recently, there was 8 different types of anxiety disorders. And more recently, we took out post-traumatic stress disorder and acute stress and OCD out of the anxiety disorders. So there's actually 5 types of anxiety: generalized, agoraphobia, panic disorder, social, and specific phobias. So again, everyone's going to present differently based on what type of anxiety they have. But often people refer to generalized anxiety. So we have this hypervigilance. So we're always anxious. I like to use the example, how many of us have lost our keys? And I know both of you are traveling. So, right. Or we think we mislocated our passport. That feeling you get, right? That instant feeling, that fight or flight, that's the sympathetic nervous system kicking in. So our brain is telling the rest of our body there's a sense of danger, whether it's perceived danger or real danger. But once you find your keys or your passport, your body goes back to a resting state. But here's what's different with people living with anxiety. They never get that real resting state. There's always that elevated level of anxiety. Even when things are going well, people will say, I feel like something bad is going to happen. I feel restless, something, I just don't know what it is, but I just can't settle. So that's a little bit about anxiety. So where do they go for help? I would say to seek professional help and find the experts that work in the field. A lot of times we just go to the doctor and we take their advice and we do what they say, but we don't really inside, we don't feel good about it, or we don't really understand why we're doing what we're doing. So I always tell people, interview your therapist, find out what they do to treat anxiety and depression, if that's what it is. But I think the first step is getting properly diagnosed. Because if we don't, then we get on the wrong treatment, sometimes the wrong class of medication. And medication can help a lot. We use what we call SSRIs to treat anxiety and depression. And those are medication that helps fire those neurons regularly so we don't have this hiccup in the brain and we keep going back to our negative self.